How much more information do you need?
Absolutely, you've got your right to do so. There's no problem whatsoever.
Your inspector.
Inspector Lypiat, yeah, Concord Police Station, okay. Is it Mark? Is it right for you, Mark?
Hello. What's your first name?
Ricky.
Hello, Ricky.
Sorry, all right.
Thank you for coming.
That's absolutely no problem. Go on. More than happy to listen. My colleague's given me a briefing, but I'll give you your opportunity to say what you need to. No problem at all.
Thank you very much. Evidence has now come out from the government that these vaccines are causing harm, injury and death on a huge scale. The government hasn't done the right thing by withdrawing them. Dr. Aseem Malhotra, who's an eminent consultant cardiologist based in London, has over the last 9 months produced a peer-reviewed paper. That peer-reviewed paper was released on Tuesday to the public. It was also released to the press. It's a very damning peer-reviewed paper. He's calling for an immediate removal of all vaccines because of the harm, injury and death they're causing. They're causing more damage than COVID itself, and that is never right. On the same day, the World Council for Health also supported this document, and they too, and their doctors, had demanded the vaccines are stopped immediately. Likewise, 5 doctors went to Downing Street on Tuesday, and they too produced this document and said, you've got to stop this vaccine rollout. So we've been waiting for the government to do the right thing. They haven't. People are coming in here today and all over the country are being injected with something, a poison, that is causing harm, injury and death on a scale that is unprecedented. I'm not expecting you to go through every document that we brought today. That would be unrealistic. But what I can do is I can show you government data that is new and fresh. I can show you a 4-minute video from the doctor himself that is showing and explaining these things are dangerous, they are toxic, and they have to be withdrawn. We are here today as peaceful, we're good people, we are here out of love, respect, and to protect our fellow man from the harm, injury and death. We are all devastated to see so many children coming in here today. The data is through the roof about the harms it's causing. We don't want any more children to suffer, we don't want anybody else to suffer. What you will see is alarming. We want these vaccines stopped. They are a weapon. They are not doing anything medically. That is no proof, and we have that today. And you as a police officers, all of you, police constables, have a duty to protect the public from harm, injury and death. These things are causing harm, injury and death on a massive scale. We understand legislation. I understand you've got rules, you've got regulations, I understand you have to follow orders. However, when those orders become unlawful and people are knowingly being hurt, your duty is to the people, not to the government and not to your bosses. You swore an oath. That oath was to be independent, protect us from harm, injury and death and loss. Today, people are walking into that room and they're walking into a situation of Russian roulette. We're demanding that that pistol is removed. These vials are taken into police custody, into detained property, because they are part of a really evil and wicked crime against humanity, against every single man, woman and child in the United Kingdom. This might sound far-fetched, however, the evidence fully supports what I've just said. I'm not here because I'm crazy, I'm not here because I've got nothing better to do, I'm here because I care. I care about you, I care about everybody here, my children and my grandchildren. These things are causing so much harm, the public is not being told the truth, and that's why we're here today.
That's fine. As you rightly pointed out, it is unreasonable to review all of that, so I'm not proposing to do that. No. I'm more than happy to go through some of the key stuff and inform it, but no problem whatsoever, okay? I think we need to just manage some expectations at this moment in time though. Clearly you have a right to protest, okay?
We're not protesting.
That is what it is, in the format that you are here, okay? So that's fine. Absolutely, as everyone is doing now, you've got a right, we have a positive duty to make sure that is a peaceful protest. No dramas there. So whilst we do that, let's stick with that. Let's not go into any other rooms whatsoever. I'm willing to listen and have a conversation with that.
That's great, thank you very much.
What they decide to do in regards to if the vaccinations are still rolling at this precise moment, okay, is down to them if they choose to roll that and stuff, okay. At this moment though, I'm led to believe that's now stopped. Okay, so we've got no rush for anything at this time, okay, but I'm also going to manage expectations. I'm not here all day and night to read loads of paper, but I'm more than happy to listen to the key stuff and watch some videos.
You're talking to a retired policeman, so I understand exactly the dynamics of it.
I will talk to everyone the same. It's no disrespect at all. I'm equal the same as you.
No, I understand the dynamics.
So that's absolutely fine. Obviously, we also have to be respectful that everything we do falls under human rights as well, don't we?
Yes.
So you've got some protection here, you've got 9, 10, 11 potentially that you want to do in regards to, you want to have like your assembly here, you want to have your protests and stuff like that. Equally, you've got Article 8 that we need to be mindful of, that we need to be looking to consider. Other people have a right to their own family, private life as well, don't we, option. So we need to be respectful of that. One person's human rights, I think 16, I might be wrong on that, so don't quote me on it, cannot interfere with another individual's. So we all have to be mindful of that.
Yeah.
So I appreciate your viewpoint. I'm here to be balanced and independent, to also the silent majority over there, and listen to other staff and go and speak to people. We have to respect that.
Okay.
I will put it out there straight away. I'm not here to tell you that, yes, absolutely, I've listened to you and I'm going to go and take those vaccines and that's going to go. I'm not saying that isn't an option. I'm just telling you right this moment, that's not first on my agenda, okay? I'm being clear. I'm more than happy to be reasonable and take some time and go over things.
Thank you very much.
But we are, as you said, we are independent. A lot of data and research has been done. If legislation needs checked and tested, clearly the right people are trying to do that. The format of trying to get other legislation and trying to force it through another way isn't necessarily going to achieve the right end goal that you wish to get at this stage. All right?
Yeah.
What was it you want to show me and point out the key bits from there to start with?
What I'll first do, this is only 4 minutes. This was released on Wednesday. This is Dr. Aseem Malhotra.
Okay.
He's the eminent cardiologist from London. He's done the 9-month review.
Right.
Okay, so.
My name is Dr. Aseem Malhotra, consultant cardiologist. Today I share my most recent publication, published in the peer-reviewed International Journal of Insulin Resistance. The title of my paper is Curing the Pandemic of Misinformation on the COVID mRNA Vaccines Through Real Evidence-Based Medicine.
John, would you like to start it?
No, that's fine.
I aim to
I'll hold it so you are if you want.
determine, through critical analysis of randomized controlled trial data and real-world evidence, the true benefits and harms of the COVID mRNA vaccines, with special emphasis on the biotech Pfizer vaccine. The conclusions are quite sobering. In the non-elderly population, the numbers needed to treat to prevent one COVID death run into the thousands. Reanalysis of randomized controlled trial data from both Moderna and Pfizer reveals that one is more likely to suffer a serious adverse event from the COVID-19 vaccines than to be hospitalized with COVID-19. Pharmacovigilance data, coupled with plausible biological mechanisms of harm, is also deeply concerning, especially in relation to cardiovascular safety. Mirroring a potential signal from Pfizer's phase 3 trial, there is also a significant increase in out-hospital cardiac arrests in England in 2021. Data which is also replicated in Israel, with an increase in heart attacks and sudden cardiac death in people aged between 16 and 39, specifically related to the COVID mRNA vaccines and not related to COVID. In part 2 of the paper, I aim to get to the root cause to understand why authorities and sections of the medical profession supported unethical, coercive and misinformed policies such as vaccine mandates and vaccine passports, undermining the principles of ethical, evidence-based medicine and informed consent. These regrettable actions are the symptom of the medical misinformation mess, the tip of a mortality iceberg where prescribed medications are now estimated to be the third most common cause of death after heart disease and cancer.
Get vaccinated.
Underlying causes include regulatory action. Guardians that are supposed to protect the public are in fact funded by the very corporations that stand to gain the sale of those medications. A failure of public health messaging has also resulted in wanton waste of resources and a missed opportunity to help individuals lead healthier lives through relatively simple, low-cost lifestyle changes. In conclusion of both papers, there is a strong scientific, ethical, and moral case to be made that COVID-19 vaccines rollout must stop immediately until raw data has been released for fully independent scrutiny. Looking to the future, the medical and public health professions must recognise this trend and eschew the tainted dollar of the medical industrial complex.
Right, wash my hands, dry
It
my
will take a
hands.
lot of time
Don't
and
let the
effort
toilet seat
to
up.
restore trust in these institutions. But the future and the health of both the medical profession and humanity depend on it. To read both papers, which are free and open access, please visit insulinresistance.org. Thank you.
Isn't he double jabbed as well, Mark?
Yeah.
So he's not an anti-vaxxer.
This is Dr. Malhotra.
Yes.
So that's that. He's double vaccinated. His
Yeah.
father died from the vaccine. He's done 9 months of research. He's come out on Tuesday. He's gone to the government departments and said, please stop this vaccine. It's causing serious issues with everybody's health, especially in the children. You heard there, 16 to 39.
What response did you get from them at that point?
Right, I would also like to show you, you don't need to read it, I'm just going to show you. I'm in contact with Dr. Malhotra.
Okay.
At his request, he's asked me would I send his papers to the relative departments, and you can see from here the emails. There's Teresa Coffey, this is from me, to all the various groups, and I CC Dr. Malhotra in it. And it's
Where is Dr. Malhotra based then?
He's based in London.
In London, okay.
Yeah.
And these are local MPs and stuff?
No,
like that?
you'll see, sorry. So it's the Right Honourable Teresa Coffey, MP Secretary for Health and Social Care, the Right Honourable Maggie Thrupp, MP Minister for Vaccine and Public Health, Dame June Rain, Chief Executive of the MHRA, Department of the Defective Medicines Reporting Centre at the MHRA, Dame Jenny Harries, Chief Executive of the UK Health and Security Agency, and Lord David Pryor, Chairman of the NHS, and finally Shamila Nabrajahani, OBE, who's the National Institute for Health and Care. They've been made aware, they've been sent that document.
Yeah. And when was that? When did you do that? Sorry.
That was sent on Tuesday.
Yeah.
Also to the Metropolitan Police, that was sent to Inspector McManus, to the Force Control Room, and Tor Garnett, the Detective Superintendent at Hammersmith Police Station.
Okay.
They have refused to stop the vaccination rollout, despite the evidence. Now, this is the latest documents from the NHS. They're saying they're safe and effective. Safe and effective. Pregnant women, they're saying it's safe and effective. We can now prove it's not safe and effective for pregnant women. So this is blatant misinformation the public are getting. That's Dr. Malhotra's paper. I don't need you to read it. I'm just showing you that it does exist.
Okay.
Okay. This is from Dr. Scott Youngblood. This was dated the 13th of September. This is an American doctor who did a slideshow for the government. In this information, he's showing the efficacy of the vaccine. It's not 95%, it's 0.84%. So they've lied about the vaccine efficacy.
Go back to your doctor's paper. That's Pfizer specific, wasn't it? Is that just specific to the Pfizer vaccine?
Yeah, that's the original Pfizer trial.
Yeah.
But they all jumped onto the back of that, including Moderna. This is the more people that are vaccinated. So if you look here in Israel, Lebanon and Jordan, I appreciate we're in the UK, but it's relative. Fully vaccinated people are getting more sick once they've had the vaccine. That should not be happening.
It kills your immune system.
United States, the more people that are vaccinated, the more people are getting sick. This is raw data from the US. This is the European data. The more people who are being vaccinated, the more people are getting sick. This is Europe's database. This is the worst part. The efficacy. It's showing that after 1 to 5 months after the second dose, it's actually going into negative efficacy, which means it's harming you. The vaccines are harming people after 5 months. This is the 3 different efficacies. So there's your Delta, there's your Omicron, there's your Omicron, the second wave. So it's going up, and then after a couple of weeks, it's shooting down, it's becoming negative, and it's starting to harm people. This is the Pfizer and Moderna. This is in Denmark, and it's showing here, after 5 months, it's minus 76% effective, which means it's harming you. And this is their raw data showing it's going under the 0. This is what we're finding across the world. This is the UK, Office of National Statistics, raw data from our own UK. 3 doses, you're 450% likely to have an infection after you've had the vaccine. 450% after you've been vaccinated. So all this safe and effective is a lie. This is from the UK. The blue is people who've been vaccinated. The orange is people who haven't been vaccinated. So if you're unvaccinated, you're safe. If you're vaccinated, you're in harm's way. So this is all government data. This is not my data. Again here, he's proven that after 5 months efficacy of the vaccine, it's going into negative. It's harming people. It's affecting your immune system and causing serious issues. And this one is what they're saying is the flu vaccine, every year they try and modify it to find out what kind of, the new strain.
Yeah.
What they're telling us is that after 8 months, they were able to produce a vaccine that they haven't been able to produce for 60 years that's effective, and they're telling us they've done it in 8 months. We now know that's a lie because they're not safe and effective, because the data's showing us that. In America, this come out the 1st of September. The American government's now saying recommendations no longer differentiate based on a person's vaccination status because breakthrough infections occur, though they are generally mild, and persons who have had COVID-19 but are not vaccinated have some degree of protection. So they're now saying whether you're vaccinated or not, we treat everybody the same. So that is also a major breakthrough. So if you've had three or four doses, people who have been admitted to intensive care unit, 173, deaths 51, 3 doses deaths 52, 2 doses deaths 8. If you've had no dose and you're unvaccinated, one person admitted to ICU.
What are those numbers from? And data stream? Where have you got that from? Over what time period?
This is from the WW. This is from the Health New South Wales. This is from Australia.
Right.
So, and this is week 35, 3rd of September 2022. So it's all referenced there. These are the different countries around the world. These are what's called a yellow card scheme. You report an adverse event. This is from 6 different countries, and it's showing millions and millions of adverse reactions, harm, and the deaths, and they're going into the hundreds of thousands. And this is from all around the world.
You can check that one on Google right now, so it'll take you less than 2 minutes.
The ultimate outcome in any pandemic is all-cause mortality should be lower. What we are now finding is all-cause mortality to death is going up and up. And already in 22, it's at 535. So this is age adjusted. That's the in line. We are now going over what is the excess deaths. It's now into the 40 and 50,000s because of the vaccine since 2021. So this doctor's conclusion, we cannot vaccinate our way out of it. And the final part is a reasonable person must ask if mass vaccination with a leaky vaccine has paradoxically worsened the pandemic. That's brief. This is the most significant document.
Yep.
This is the Lighthouse News.
You just read me a few minutes ago.
This was released on August the 29th. This is all government data, and everything's checkable, and what they've done is they've put all the links in. So who's talking, sorry?
Civvies.
All right, no, I beg your pardon. June 2022, monthly excess mortality in Europe.
Sorry, this is a world report as opposed to local government.
But it
links in.
It links in.
Perfect, yeah.
So the different colour scheme is the excess deaths. So that's just giving you a colour graph.
Yeah.
And it explains it in detail. So it keeps peaking. It's peaking again. Number of deaths in England and Wales, the 5-year average.
Your previous one was 45,000.
Number of deaths following COVID-19 vaccination in England, this is dated from January 2021 to May 2022. That's the average. That's where we are now. It's going through the roof, and it's because of the vaccine. 1 in every 73 vaccinated people were dead by May 2022. That's huge. That is cause for concern. COVID-19 vaccines are at least 75 times deadlier than every other vaccine combined. So take every other vaccine since the end of the 1800s, put them all together, the COVID vaccine is causing 75 times more death than every other vaccine in history. We have got a problem, and it's not because of COVID, it's because of the vaccine. This is government data, this is all government statistics. Our own government.
I don't doubt that.
Yeah. So again, number of deaths reported, adverse reactions, it's going through the roof. Mortality rates are lowest amongst the unvaccinated in every single age group. So all this, we're protecting ourselves with the vaccine, it's a lie, it's a blatant lie. It takes approximately 5 months for COVID-19 vaccine to kill thousands. This is the data here, so they're the vaccinated, the unvaccinated. So the vaccine is killing more people statistically. COVID-19 vaccine is weakening the immune system. That's why people have to keep having boosters. They're not having boosters because the vaccines are failing and they're harming people. And I'm going to go through to the end part. 9 in every 10 COVID-19 deaths in 2022 has been amongst the vaccinated population. That's government extrapolated data. This is where we have a huge concern. Newborn baby deaths are at critical levels and birth rates are falling. So we're having less children. There is now infertility issues because of the vaccines. Menstrual issues, deaths of babies, miscarriages, they're gone through the roof because it's all post-vaccination. And the evidence is also documented in all the government data, all the source of the information, it's all checkable on the government website. COVID-19 vaccine increases the risk of suffering a miscarriage by 1,517%. 4,113 child deaths following COVID-19 vaccines. That's horrific. COVID-19 increases the risk of developing cancer. Look at this. That's the flu vaccines. This is the COVID vaccine. This is number of miscarriages suffered as an adverse reaction per 1 million doses administered. That's the flu vaccine. Look at it. It's gone through the roof. Again, number of adverse events related to cancer. That's the flu vaccine. This is since the COVID vaccine.
And is that UK data?
This is UK, yeah. And UK, America, around the world. This is happening around the world.
Google, sir. You do it right now on my smartphone for you.
Number of cancer cases per 100,000 doses administered, flu vaccines 2008 to 2020, it's virtually non-existent for cancer. Since the COVID vaccination, it's going off the chart. 90% of COVID-19 vaccinated pregnant women lost their baby, but your government and medicine regulators choose to ignore the data. It's their data. These things are lethal. So that's just one.
No, that's fine. And I don't doubt the stat. Well, I remember a couple of things before it. As your friends quite rightly pointed out, I'm sure I can Google some of that.
Everything.
The problem you've highlighted is significant over years, clearly, and you're saying there is deaths in the van. And I don't doubt the data strange that you've got. Clearly, I'm sure if you had someone sat on the other side of the fence, they will come up with some other data.
But they can't because that's from the government.
No. What I'm saying is comparing like for like against countries when we've got other different types of living conditions and other issues.
I understand that.
That's what we've got to be careful. I could look that data up on Google right now, okay, and check and test that, which would take me time to check the verity of the source and stuff. But equally, again, in this country, that data should have been reviewed by World Health Organization, NHS and stuff like that. And that data, as you rightly pointed out, is available free on charge for Google, which again, is free for every member of the public in this country if they choose to do so. So no one is forcing, Barry, I will come back to you in 2 seconds, no one is forcing people to be here to take that thing. And I'm just trying to put in things that we have to have that balance in between everything. And I don't doubt that data that you're providing. And anything that would increase in death is a concern.
You've listened to Dr. Aseem Malhotra.
Yeah.
Would you like to speak to him now on the phone?
Not right now, because
it
won't impact it. We can have a conversation, it needs to be
So he's confirming all of this, he's telling you this.
I get that, but we've also got to balance that we pay people in this country, whether we like it or choose it or not, to do the research and make decisions for us. If we agree or disagree, we have processes that we can range to go against it, don't we? But we have bodies that have sat for the last 2-3 years, haven't we, reviewing whether that's daily occurrences or not. There should still be something in regards to that. I will come to you, I've not forgot you, don't panic. So I also can take one person's word against other data that I haven't got available to me, if that makes sense. So I just need to be balanced. Absolutely, go on.
Your thought process is flawed.
Okay.
Severely flawed. When we came in here, there was children in there that couldn't possibly be given informed consent because no one has been given informed consent. Your role as a police officer, same as it was with mine in the military, was to protect people.
Absolutely.